Lauren here from Mildred L. Terry Public Library, and this program is called Stress Can Be a Real Headache. In this program, a nurse practitioner, Morgan Duke, will walk us through how stress can contribute to headaches and offer some lifestyle changes that can help let stress go. So, Morgan Duke is a nurse practitioner specializing in neurology, and she's specialized in that for a little over 2 years now. She got her undergrad and graduate degrees from Auburn University, just up the road from us, and she specializes in treating patients with neurological issues. She works with patients including but not limited to those with headache disorders, dementia, Parkinson's disease, strokes, and seizures. She has a passion for improving the quality of life of everyone that she comes in contact with. So, I hope you enjoyed this program, and I'll be back at the end with some resources that we have available on our website.
So like Lauren said, my name is Morgan Duke. I am a neurology nurse practitioner in Alabama, and I take care of a lot of headache patients. So I'm going to talk about some common headache disorders today. Mostly I'm going to talk about tension headaches and migraines because those are the most common types of headache disorders. There are a lot of different types of headache disorders, so we're not going to cover all of those today, but just kind of figure out what makes a tension headache and migraines different. What is a headache? Headaches are common neurological disorders affecting a lot of humans. Over half of the U.S. population. They affect all different ages, all different backgrounds, income levels, geographic locations, male, female. Headaches do not discriminate. They're characterized by pain. They're usually benign, meaning they're not harmful. They just are aggravating. They can be associated with more serious diseases, so it is important to talk to your healthcare provider about your symptoms just to make sure that there's nothing that could potentially be dangerous causing your headache. There are many different types and causes of headaches. We're going to discuss more of, like I said, the tension type headaches, which are chronic, and migraine headaches as well. And we'll also discuss some frequent causes of headaches that include sleep apnea, hypertension, which is high blood pressure, and medication overuse. Headaches really do affect people's lifestyles. They're painful. They can be debilitating. It can make you miss work. And there's definitely a financial burden to headaches. Visiting the doctor, they require medication, so that's money. And missed work, which is time and just a financial burden for some. They can affect your family and social life. You can miss out on events that maybe your kids have going on, or activities with friends because you're just scared that you're going to get a headache, or you have a headache and it requires you to miss the activity. Anxiety and depression are definitely common in people with migraine, more so than in healthy individuals. So this slide, it says types of headache disorders. It just shows you kind of a picture of tension type headaches, migraines, and then medication overuse headaches, which are going to be the 3 types of headache disorders we discussed today. You see this picture. Here are 4 types of headaches: sinus, cluster, tension, and migraine. We're not going to be talking about cluster headaches today, but you can kind of see where the red areas are. That's primarily where the pain occurs. So you see that sinus headaches are kind of like right above your eyes and right below your eyes near your nose. Tension headaches kind of occur all over the forehead. They're not really localized to one area. This kind of like, my whole head hurts. And then migraines are typically one-sided. So we're going to talk about tension type headaches first. They often begin during teenage years, and they affect females more so than males, so a 3-to-2 ratio there. A lot of times they're related to stress, or musculoskeletal problems in the neck, meaning tight muscles. We carry a lot of stress in those muscles in our upper neck. Also looking down at screens at work, if you sit at a desk, that can also cause it. They can be associated with depression and anxiety, other conditions like fibromyalgia, and also irritable bowel syndrome. They can be episodic, which means they occur less than 15 days of months, just kind of here and there, not every single day. They may last a few hours up to a few days. Or they can be chronic, which means they occur more than 15 days a month or daily, so around 30 days a month, all the time. So unremitting, this is a patient that comes in and has a headache, and they say they have a headache every single day, and they've kind of had a headache like this for a year, 2 years, their whole entire life. So that's very common with tension type headaches. So tension headache features, typically patients describe a pressure or band, like a rubber band feeling of tightness around their head. Usually tension headaches are bilateral, which means occurring on both sides of the head. They can spread into the neck, or they can start at the neck and work their way up. Most migraine features are absent, and we'll talk about some features of migraines soon, but that means that there's usually not nausea or light sensitivity or some of those other type symptoms that are common with migraines. They don't really occur with these types of headaches. And a lot of times these types of headaches occur, they improve with physical activity. So getting out and being active, going for a walk, getting your heart rate up and doing something typically helps these headaches improve. So now we're going to talk about migraines. So migraines are characterized by an activation of stimuli deep in the brain, and they release an inflammatory substance around the nerves and blood vessels in the brain, and that's what causes the pain. Migraines do affect females more than males. They're common between 22 to 55 years of age, but definitely children can have migraines as well. Children's migraines may present differently than adults, and I don't treat children, but children may complain of stomach pain or nausea or diarrhea or other symptoms like that, maybe not necessarily head pain, and some kids can't tell their parents, if they're young enough, that their head hurts. So it's really important to listen to their symptoms. Migraines can occur with or without aura, and aura can be visual, auditory, which means sound, smell, or taste disturbances that occur 5 to 30 minutes before the head even starts hurting. So some people describe flashing lights, zigzag lines, black spots. They see rainbows, so lots of different things. Some people smell like a gasoline or a burning sensation, and some people may hear noises like a sharp noise, and some people can taste like metal or something really, really sweet. There is a genetic component to these, so it is common that migraines are passed down through family members. Features of migraines include these headaches last between 4 up to 72 hours, which is 3 days. It's common for migraines typically last at least 4 hours if not treated. They can be episodic or chronic, meaning they can kind of just come on at random, or you can struggle with these for months on end, for years on end. Migraines are always one-sided or unilateral. You might have a throbbing pain. Like I said earlier, they are associated with light or sound sensitivity, or both of those. Usually they have nausea and possibly vomiting. Not everyone struggles with that though. Also, you might have allodynia, which is a tenderness to touch, something that might not normally hurt to touch. When you have a migraine, it hurts. Like normally if you were to brush your hair, that wouldn't hurt, but with a migraine, a lot of times that hurts. Triggers for migraines. So it's very common that things trigger a headache. Certain foods, chocolate, cheese, MSG, which is in a lot of Asian meals, red meat, alcohol for some, especially red wine and beer. It's the way that they're fermented. Environmental conditions, so weather changes, higher altitude, so being up in the mountains, just pressure when it's about to rain. Sometimes it can make people have a headache. Certain smells, like really strong smells, paint, car fumes, perfume, flashing lights, noise, withdrawal from caffeine. So if you give up caffeine or haven't had your cup of coffee in the morning, sometimes can trigger. Sometimes too much caffeine can also do that. Hormonal changes or an imbalance in hormones, and that's common for women, especially when they go through menopause or start to go through menopause, or even girls who have a menstrual cycle. It's common to see headaches clustering around that time of the month. Smoking. also can lead to migraines. It constricts the blood vessels and makes the blood vessels just really tight and really angry in the brain. Either stress or stress let down, meaning after a stressful event, when you're finally able to relax, that can cause a migraine as well. Sexual arousal and also physical activity can make migraines worse or can trigger a migraine. This chart just shows you the difference between tension headaches and migraines. We went through both of those, so you can just review this if you'd like, but migraines are one-sided, tension headaches typically are both sides. Migraines last anywhere from 4 hours up to 72 hours, and tension headaches typically last less than 4 hours, but they can be continuous and kind of reoccur. Migraines tend to be pulsating and pretty severe pain. Tension headaches tend to be more of a throbbing pain or a pressure, like it feels like you've got a rubber band around your head, and tend to be more mild or moderate. Nausea and vomiting occur typically with migraines, maybe not vomiting, but definitely nausea. And tension headaches typically don't have those symptoms as often. Migraine patients do have light and sound sensitivity usually. Like if you have to go lay down in a dark, cool room that's quiet, that could be a sign that your headache might be more than a tension headache. Aura, those visual and auditory and sensations before the headache occur with migraines and do not occur with tension headaches. And then other symptoms like vision changes. Sometimes people get blurred vision with migraines, and with tension headaches, people might have neck pain and don't really have vision changes. Another type of headache that is very, very common is medication overuse headache, also known as rebound headache. And this is something that I want to stress. It is very common in our population for patients who have a headache to take something like Tylenol, ibuprofen, Motrin, Advil. The headache goes away and then it comes back. So you take something again. It goes away and then it comes back. So you take something again. And that's a cycle. And a lot of patients, up to 80% of patients with chronic headaches overuse acute medications. These can include Tylenol, NSAIDs, which are ibuprofen, Aleve, Motrin, aspirin, goody powders, Excedrin, migraine abortives for patients who use sumatriptan, rizatriptan, or the like, and also opioids, so chronic pain management. This acute medication use, this refers to taking something more than 10 days out of the month. So we really try to limit things to about 2 to 3 times a week. That's the only time we want you to take something, because more than that, it puts you in that risk for rebound headaches. The treatment is to stop using the acute medication and talk to your doctor about a preventative medication or something that you would take every day to prevent a headache. There are tons of other causes of headaches, such as untreated sleep apnea, high blood pressure, sinuses and allergies, medication side effects, vascular disorders, and other less common but serious conditions. Lifestyle factors is also a major contributing factor to developing headache disorders, such as sedentary lifestyle, or meaning a non-active lifestyle. And what I mean by that is not exercising. So primarily sitting, desk job, get home, even if you're running around with the kids, still not engaging in physical activity, we would consider that a sedentary lifestyle. Obesity, high blood pressure, smoking or tobacco use, stress, poor sleep, meaning less than 7 to 8 hours of sleep a night, and other comorbid conditions like anxiety, depression, fibromyalgia, and irritable bowel syndrome. So good lifestyle modifications that not only can make you feel better, can make you healthier, but also prevent headaches, is to engage in regular physical exercise. It's good for us, it's good for our bodies, and it's good for our minds. We recommend 30 minutes a day of aerobic exercise, and that just means cardiac exercise, getting your heart rate up. About 5 days a week, but some is better than none. Stay hydrated and talk to your doctor about what level of water intake a day is appropriate for you. Diet and weight loss, avoiding those triggers that we discussed earlier, like certain foods or smells. Stress relieving tactics, so for some that might be meditation or prayer or deep breathing exercises, or just removing yourself from a stressful situation. Good sleep hygiene, meaning getting at least 7 to 8 hours of sleep a night, avoiding screens before you go to bed, because that can actually decrease the blue light in the back of the screen can actually decrease your melatonin levels and tell your brain not to go to sleep. Smoking cessation, so stopping smoking, that includes vapes, marijuana, cigarettes, all forms of tobacco, and limiting alcohol intake. Thank you so much for allowing me to just talk to you about different types of headache disorders. I hope that this has been helpful. And if you do struggle with headaches and have questions, I encourage you to talk to your primary care provider or any doctor that you see about hopefully helping get some remedy for your headaches. Thank you so much.
It's Lauren again, and I am back to walk you through the steps to access our online health resources. So, the first thing that you'll do after accessing our website at cblga.org is you'll click on the 3 horizontal lines right here about halfway down the page. From there, you'll click on Research It. Scroll down to the Health and Wellness Resources. And from there, you'll be able to access all of the health resources available through our website. Those include Medline Plus, Health Finder, McGill's Medical Guide, and several sites available through Galileo and Credo, as well as all of these down here. So the one that I'm going to focus on today is Medline Plus. Just click the link and it will take you to the Medline Plus page. So you'll see that they have the topics right here on the page if you're looking for healthy recipes or just the medical encyclopedia. You can browse through that, or you can come right up here to the search. And since we're talking about headaches today, I will continue that theme and type in headaches. So, once you've done that, it will give you access to all of the articles and links relating to headaches, like managing tension headaches at home, headache, what to ask your doctor, managing migraines at home, and so much more.